And we're back here on Good Morning Lake Martin, and we have a guest here with us this morning. We'd like to welcome Dr. Kevin Sublett back to the set. Dr. Sublett, it's good to have you.
Hey, Cubby. Thank you very much.
It's always good to see you.
It's good to be here.
We have some exciting news that we want to talk about, and this has been a great topic. As I learn more about it, it's really exciting. We have a new partnership that we'd like to talk about. Tell us a little more about this.
That's true. We are now the UAB Heart and Vascular Center of Central Alabama here in Alexander City. And this has been the culmination of efforts from UAB and our practice, and we're really proud of it, really proud of it.
You know, when I heard about this, I thought this is a great thing. We did something similar to this a few months ago with the Cancer Center and now with the Heart Center. It's really a great partnership, and it's going to be very beneficial to the people in the Lake Martin area that come into this area for health care.
I appreciate that, and we're really proud of that. And you know, it's all about access and convenience and access. And so our goal is to be able to bring subspecialty care in cardiovascular services to the community here in Alexander City in a very convenient way.
We talked about some specifics before we came on. Let's get into some specifics for our viewers. Some of the services that will be provided here. Tell us about some of those.
Well, we'll provide interventional cardiology services, which in lay terms or common terms means the ability to open up arteries and restore blood flow and be able to treat heart attacks. Also pacemakers and perform defibrillator implantations. We've also been able to add some new services. We have access to what are known as electrophysiologists. Right. Electrophysiologists are super specialists in the field of cardiology. You know, really, the cardiology is a subspecialty of medicine, but these electrophysiologists are physicians who spend additional time in training, learning specifically abnormalities in the heart rhythm. And we will have access to electrophysiologists, and they're actually going to be coming down and doing a clinic here with us. So they'll be able to see patients from all over, you know, here in Alex City and address heart rhythm problems.
So in some instances then, some of our patients can get things done here, or they may go to Birmingham, and then in some cases, some of the doctors and physicians may come here. Some of both.
That's right. That's correct. And again, I want to emphasize it's all about access, because it's access for the patients. It's access for me in terms of being able to with a phone call, speak to one of the top physicians in the field very easily, and by obtaining that information, then I can share that with the patients. And when a patient does need to be transferred to Birmingham, we'll be able to do that very easily, you know, and directly. And I think it's just really a great thing. I'm very happy and very proud that we've been able to do it.
You had also mentioned something too about the meds that you had we talked about off air. Tell us a little bit about that as well.
Well, there are several research protocols that are available at Birmingham and for cardiovascular drugs, and I think you may have heard most about it when you hear about new cancer drugs. Right. But similar to new chemotherapeutic agents in the field of cardiology, we have new drugs for treating cholesterol problems. We've always heard about the statins, but there are brand new drugs that have come out, and a lot of people have had problems taking drugs like Lipitor and Zocor. Sure. But there are brand new drugs that are coming out for the treatment of cholesterol that are not statins. And so those type of drugs, we have access to drugs for treating heart failure, and also drugs for treating irregular rhythm problems. And that's just the tip of the iceberg, really.
That's amazing. You know, of course, the name UAB itself is world renowned. I mean, people all over the world know of the UAB hospital. It's second to none, in my opinion. I mean, it's one of the top in the world.
That's correct.
And we're gaining now some access to UAB that we haven't had before, and we're getting to do that right here in Alexander City.
It's really a privilege, and to be able to have that. And when you think that people travel from all over the planet to have procedures performed at UAB, it's a really great opportunity.
Now, we also talked that there may be it may be different whenever you get phone calls from your office. Now, it'll sound a little different. How would they patients that have known you for many years and use you for many years, it may sound a little different when they hear your office call.
That's correct, because our scheduling will be through. It's done through our office, but you'll hear UAB Heart and Vascular when you call, and that doesn't mean you have to travel to Birmingham. You'll still be able to come to our office and everything, but it's just going to be a different. Actually, the same voices that are there in the office, many of the same people, but just a new title.
Yeah. Well, as you said, this has been in the works now for quite a few months, and I think this is an excellent addition to our city and our area. We have people that come into this area for medical treatments from a lots of places.
That's true.
It's going to be very convenient for them as well.
That's true, and hopefully we'll be able to build further upon this relationship and continue our growth and partnership with UAB for the future.
Absolutely. Now, when will this actually begin? When will this partnership actually start?
We've started.
We've already started. We're there.
It started. It
That's
started,
good.
and we've already gotten off to a very good start. And I'm really proud of the progress that we've made thus far.
That's awesome. Well, listen, keep us informed. We like to
I
know
will.
of progress in our city and our Lake Martin area, and we like to keep our viewing audience informed as well. And anytime you have more information, we like to know.
Will you let me come back?
You can come back anytime.
Oh,
We
thank
don't
you
have to
very
talk
much.
doctor stuff if you don't want to. It's okay. It's
Thank
good to
you
see
so
you
much,
again.
Cody.
Thank you.
I appreciate it.
We'll be right back with more right after this. This is Good Morning Lake Martin.